You want to safeguard your life. You want to safeguard that of your family as well. If you wash your hands, wash them under running water with soap. I see people sometimes use the latrine and then they just go and do this under the tap. Well, so more, and I'll bet it. But staying with us, joining us for a conversation, actually, we have Miss Jennifer Edubia-Boahen. She is a health promotion officer at the Greater Accra Regional Health Directorate. She joins us for a conversation. That was a beautiful animated piece. Is it from the Ghana Health Service?
Yes, please. It's from the Ghana Health Service with sponsors from our partners.
Wow. That's actually very interactive. It's a very good animation over there. I also do know that there have been some drives, especially in the Western region, where this has been on the uptick. But let's even start from what cholera is, very briefly, and what the status quo is in the country when it comes to cholera. What is cholera?
All right, so cholera is a bacterial infection. It's an acute one. Suddenly you see that maybe you start having diarrhea, and then you start vomiting indiscriminately. You can't hold yourself. And without proper care, you see that it can escalate and get worse. Some of them will start experiencing shock. And how do people get this? People get it through ingesting contaminated food and water. So people that may have eaten food that has been contaminated with the bacteria, when you eat it, you see that you start having the infection. Yes. And we've seen it starting, if you watch the video, we've seen it starting from communities where they've had poor sanitation. Where there is poor sanitation,
rubbish here and there, open defecation, stuff like that.
Yes, and then not having good water, good source, drinking water, yes.
Can it be passed on? Is it contagious?
Yes, it's very contagious. So as you saw in the video, he said that it's very close to you. You don't know who may have it, because once people have the infection and they do open defecation and they come in, they don't wash their hands well, then they start leaving the pathogen on surfaces. Even with the money that we have, money passes through a lot of hands. So once the person has not washed their hands well and they touch the money, they can leave the infection on it and it spreads easily.
Or even the CD notes?
The CD notes,
even
yes.
The coins? Because metals can...
Yes.
Wow.
Yes.
So even that, you have to be careful, which is why washing hands properly is important.
Yes.
Why should we attach much more importance to this, especially in the period of this outbreak?
Yes, so you see, we have people who are already infected in the system. So we should all have in mind that we have the bacteria around us. Okay. The only way we can break the infection is for us to be doing the safety protocols that we are talking about. So you can be exposed. The most important thing is that you are washing your hands, you are eating hot food. The food that we are eating must be prepared in hygienic conditions, and then it must be served hot. Food that has to be eaten cold must be eaten cold. Food that has to be preserved. So those are food vendors, our sellers, from the market women, we advise that they don't display the food on the floor because the bacteria is already in the system. So as the food is on the floor, it can get contaminated, and then the money, we've mentioned it. So everyone must protect themselves, yes.
I see. So this is like COVID number 2, at least for those who don't like washing their hands very much. Yeah. Not wearing a mask, but wash your hands.
Wash your hands, yes.
Ensure there's a lot of hygienic, take care of your environment, and also don't engage in things that will attract flies and the rest. We saw the flies in the stubborn, very naughty flies. But which are the at-risk groups? Which groups are most at risk?
Yeah, so with all that we've been saying, the most at-risk group is someone who doesn't wash their hands.
Oh, sir.
Yes, if you don't wash your hands, you're at risk.
I'm sure you're talking to some people.
Yes.
I know some people, like I said, who even go and use the washroom and not do number 1, they'll do number 2.
And don't wash their hands.
Some will not even wash, they go out. I see some of them. Others, they will just open the tap, no soap, then they are gone.
Yes, so that is not the best. So you have to wash your hands properly, like we've been talking about. Wash your hands under running water with soap.
Okay.
That is the key thing, with soap. People, before they eat, they wash their hands without soap. It's after eating that they wash with soap. And some people, some food, if it's not soupy, they think that you don't have to wash your hands. And as Christmas is approaching, you will see that people will go for parties. Foods will be served. Before you get to the food, you may have shaking hands with people. We expect that when the food comes, at least wash your hands. If you can't, and it's finger food, that's why they serve it with the toothpick. make sure that what you are using to pick it is clean and it's not dirty, or you can use tissue. So these little things can save you. So another at-risk group is those who travel a lot. We know that some parts of the country is endemic with cholera, even in African countries. So people may have gone to other places and have contacted the disease. Already we have it in Ghana, and then some of our cases even came from Nigeria. We had some people that brought in the infection from Nigeria. So people who are traveling around, yes, could be infected and we could spread it around. And Christmas, we are expecting our people to come. You don't know where someone may have been. So that's why as an individual, you are supposed to ensure that whatever you are ingesting, the water you are drinking, the food you are eating is safe. Yes.
What are the signs and symptoms? How do I know I have cholera?
Yes, so the first one will start with some stomach upset, and then you start having diarrhea. And the diarrhea for cholera is like rice water. The lab people will tell you, yes, it's appear rice water-like. And then those who have it, you can't hold yourself. So it can maybe start at 1, and then within 24 hours, it can escalate. It can become worse.
You don't want to wait for 24 hours.
We don't want to.
So once you see the signs and symptoms.
So once you see it, we say that the first thing you have to do is to rehydrate. So when you start having diarrhea infection, you drink enough water, you get coconut or anything that can hydrate you.
Give you some electrolytes.
Yes, before you now seek medical attention.
How important is ORS in all of this? And
yeah,
how
so
do people
ORS
even, should they preferably go to the pharmacy and buy, or can they use, because growing up we were taught how to make
yes,
ORS.
so ORS is very key. So you can also hydrate with the ORS, but don't buy Imodium. You know, people are doing self-medication. Their plan is to stop their diarrhea. Yeah. We don't want that. I mentioned earlier, yes, cholera is bacterial infection. So buying that one will not prevent the damage that the bacteria has caused within you. So we expect that you hydrate and then you seek medical attention. And then it's free. Coming for treatment is free.
Okay. And it's easily spread, right?
It's easily spread because you don't know who may have had it. And then if you are in a house where someone has had an infection, people who have the cholera infection, or if you have started experiencing diarrhea, please, we say that don't cook because you can easily spread it. Yeah. If we don't take proper care, it can spread easily within even families. So you have a family where maybe one person brought it. By the time you realize, about 6 people in the household have also had it because of how it is. So we expect that once someone is sick, bring the person to the hospital, and then we will know how to take care of the person.
Is cholera curable? How can it be managed? Give us, and maybe add where people can get information when... All
right, so that's why I said that the first thing you do is that you hydrate, and then you get to the nearest medical center. The physicians and the nurses there will take care of you. They'll give you the proper treatment. Yes.
Okay, and if people want more information?
If you want more information, so you can come to any clinic around you, or you can also go to the Ghana Health Service website to seek more information. So this festive season, we know with all that I've said, cholera can easily spread. And we have mentioned that the main source is through contaminated food and water. And Christmas comes with a lot of eating and drinking. So we want our people to be very careful so that we don't have escalated cases after Christmas. Yes.
Are there any other preventive measures?
Yes, so we mentioned the sanitary one. So in communities where there is no good, proper latrines, we ensure that maybe opinion leaders can help. And then community members too should avoid open defecation.
Okay.
Yes, we've been talking about it a lot. We have communities where they can't do anything about it. That way, we've taught them that if you have to do open defecation, make sure you dig and then you bury, so that we don't expose our community members to infections.
All right. I'll take your final words. I know that from Saturday thereabouts, or was it Sunday, there was a drive in the Western region, which has been the most impacted region, vaccinations and all that, and it's ending tomorrow.
Yes.
Maybe a specific message for the people in the Western region?
Yes, so the reason we are doing the vaccination, we started from there, is because of the cases we are recording there. So we want our people who are around there to actively participate in it. It will protect each and every one of us if we get the vaccines.
All right. Jennifer, thank you so much for joining us for a conversation this morning. And we pray for the very best. That is Jennifer Edubia-Boahen. She's a health promotion officer at the Greater Accra Regional Health Directorate. Before I...